Hello and welcome to today's programme, Politics in 10 Minutes. Today I'm going to be looking into the recent report that was released by Norman Baker, the Home Office Minister who has since resigned, which compares the UK with other countries on its drug laws. I will be looking into what effect this has had on our current drug policies and whether there needs to be a change. I will also be talking to Transform Drug Policy Foundation to hear their take, as well as revealing what the public thought on this issue. Let's start by looking at what the report includes. It was carried out as officials from the Home Office took part in what's called fact-finding visits to 11 different countries: Canada, Czech Republic, Denmark, Japan, New Zealand, Portugal, South Korea, Sweden, Switzerland, the United States of America and Uruguay. And it has since been reported that it has shown that there is no direct link between tough laws and the levels of illegal drug use. So what does the report show exactly? Well, the Home Affairs Select Committee have said that the report, Breaking the Cycle, highlights that there is more that can be done to tackle drug addiction. The report starts by showing what research the Home Office has presented when looking into the UK drug laws. The 2010 drug strategy looked at drug activity across 3 strands: reducing the demand for drugs, restricting the supply for drugs, and supporting users into recovery. This showed improvements in prison-based treatment, increased numbers of people accessing help, and a new focus on lasting recovery. It says that even though the levels of drug use in the UK have been known to be high, there are also signs that it is close to the European average following years of decline. Therefore, the report shows that every country has the same aim to try and reduce drug misuse, but approaches it in different ways. Let's look at what was actually found. So during their visits, they studied how other countries tackled drug use and made interesting discoveries. For over 40 years, there's always been an official political rhetoric that to tackle the problems such as heroin, cocaine or cannabis, there can only be harsher penalties. But their studies could change the way we look and think about it, as there are clearly other ways of dealing with this. Clinics were visited in Canada, Switzerland and Denmark, where drug users are able to bring illicitly purchased drugs for use under strict supervision. This comes with evidence that drug consumption rooms address the problem of public nuisance associated with drug scenes and in reducing health risks for drug users. And Switzerland also own a clinic that is used to inject patients with pure heroin, again under supervision, and this is part of their treatment for drug dependency. This has been trialled in several countries, including the UK, which has shown that this treatment is effective in reducing illegal drug use. A part of Portugal's legal system involved Dissuasion Commission lay panel who sit below the criminal system and decide whether someone caught in possession should be charged under the legal system or sent for treatment. In comparison to the Portugal policy in Baltimore, America, a drug court that was visited gave people who are charged a choice of pleading guilty or entering a treatment program which is overseen by a judge. What I find the most significant information that was put forward is how Uruguay and some American states have taken on policies where the production, supply and use of cannabis is legal. The aim is to try and disrupt organised crime and gain greater control over the use of cannabis. The American states have taken a much lighter approach as opposed to Uruguay, who has limitations to the size of the market and have very strong views on how much cannabis one person can purchase at a time. The results to these experimental laws are not yet known, but they will be closely monitored and we should be able to find out in years to come. Our After these studies had been carried out and the report was released, the outcomes were looked over by the Home Office, who feel decriminalisation alone is not the answer. But Norman Baker has made a statement in saying that drugs should be decriminalised altogether and it should be taken on as a health issue instead. There has been controversy, however, as David Cameron has said he does not believe in this and it could be a dangerous move to make as it could encourage children to take drugs. So, should drug use be treated as a health issue? I went out onto the streets of London and asked the public what they thought. Do you think that drug use should be treated as a health issue rather than a criminal offence?
Yes, I do.
In most instances.
If you've got health issues and you need drugs, then yeah.
I can in fact tell you that the majority of the people that I spoke to agree with Mr Baker, but is this the right thing to do? I spoke to George Merkin, who is the Policy and Communications Officer for the Transform Drug Policy Foundation, who carries out research into drugs and drug policies, to hear his view.
Do you think the law is too tough on people who commit drug offences?
Yes, I do. I mean, this is actually what the report itself showed. It showed that harsh penalties for drug possession and use don't actually deter people from taking drugs. So if you look at countries which don't have criminal penalties for drug possession, such as Portugal, what you see there, you don't see dramatically higher rates of drug use. So if you're aiming to reduce the prevalence of drug use in society, then you don't need to criminalise people or punish them in order to deter them from taking drugs. We think that if you want to improve the health and well-being of drug users and society as a whole, it's far better to use public education and to implement harm reduction measures so that drug users can use drugs in a safe and controlled way.
He went on to speak about whether he thinks it should be treated as a health issue.
It's an interesting debate because most drug users, in fact around 90% of illicit drug users, use drugs non-problematically. So that means they don't need any help whatsoever. There's only about 10% of the drug using population who get in trouble with their drug use, and we think that 10%, that minority, they should receive medical treatment and help and support rather than be criminalised for their drug use. Criminalisation essentially exacerbates their situation. It makes it harder for them to find jobs, to get housing, to travel. It can severely limit their life chances. So we think healthcare is a far better option for the minority of drug users who do actually need support.
He then went on to discuss whether there would be an improvement in the health of drug users.
In the UK, there was a big movement towards treating drug use as a health problem back in the 1980s when there was a big expansion of harm reduction services, so things like needle and syringe exchanges. And the effect of this was to dramatically reduce rates of HIV in the UK among injecting drug users and to improve the health and well-being of them overall. So there's plenty of evidence that these kinds of measures, which don't necessarily seek to stop people from taking drugs, but they seek to make sure that they take drugs in a safe and hygienic and clean way.
He lastly gave his response to David Cameron's comments on decriminalisation giving out the wrong message.
No, I don't. And this is actually precisely what the Home Office report was saying. It was saying that it doesn't seem to be any kind of message that is sent by criminal penalties for drug laws. So, again, the report highlighted the case of Portugal. The fact that there are no criminal penalties for drug possession in Portugal hasn't given a green light to the whole Portuguese population to start taking drugs, and that's why drug use in Portugal hasn't increased since it decriminalised drug possession. So this idea that penalties for drug possession are an effective way of informing the public about the risks and dangers of drug use simply isn't borne out by the evidence. And this is obviously a line that is often used by UK government officials, but it's simply not really the case. And if you look at the case of tobacco, for example, in the UK, that's a drug which is legal, but rates of tobacco use have been declining for the past 20 years or so, and that's been achieved without criminalising anyone, without putting anyone in prison. It's been achieved through sensible public health-focused regulation and through pragmatic public education. And we think that we should apply the same principles to currently illegal drugs. We should stop criminalising people for possessing them and using them, and we should educate them and regulate these drugs safely.
So, as you can see, there are very mixed views on whether our drug laws should be changed. Since Norman Baker has suggested the idea of drugs being decriminalised and treated as a health issue instead, many of the public and charities have agreed, showing this is an issue that will continue to be debated, especially as the government of the day feels this would be putting out the wrong message to the public. It will be interesting to see what happens in the near future and whether our drug laws will be changed in line with the report. Well, that's it for today's programme. If you have any views on today's story, you can leave your comments on the website or email us with any queries you may have. You can join me again next week when I'll be looking at another political story in the headlines on Politics in 10 Minutes.